Hip arthroscopy is a keyhole surgical procedure of the hip joint. It is performed under a general anesthetic and involves 2 or 3 1-centimetre cuts above the hip joint. Through these holes, a small camera and instruments are safely placed into the hip joint. Keyhole hip arthroscopy is a highly specialised technique that is much less invasive than traditional open surgery. It requires significant experience and specialist fellowship training to be performed effectively. Hip arthroscopy is used to treat a variety of conditions, including hip dysplasia, labral tears about the socket of the hip joint, femoroacetabular impingement, where the ball of the hip joint collides with the side wall of the socket of the hip joint, and osteoarthritis of the hip and other diagnostic conditions. It is very effective in relieving pain caused by labral tears and loose chondral flaps of the hip joint, and it improves the range of motion of the hip joint when the bony impingement is identified and removed. It is not effective in the management of hip arthritis unless there is a very specific problem, such as a loose body causing catching pain within the hip joint. It has also been shown that if the problem is identified early, surgery may slow the progression of an arthritic condition. The procedure takes up to 90 minutes and may be performed as a day surgery procedure. Medications will be given for pain relief in the early post-operative period, and icing of the hip joint is encouraged. Patients are mobilised immediately after surgery and are allowed full weight bearing. Early hip joint mobility is encouraged. A full program of return to sport and work will be tailored to your needs by our physiotherapy team, and as soon as the wounds are healed, hydrotherapy is recommended. Potential risk of the operation are the standard risk of undergoing any general anaesthetic. Infection rates are very low, and it's possible to experience numbness on the inside or outside of the thigh, but this usually resolves within a few days after surgery. Most patients do not require the use of mobility aids. At around 2 weeks after surgery, most patients are able to walk, sit, and cycle without pain and have returned to work. Running normally commences between 6 and 12 weeks after surgery, depending on the recovery, and most patients return to high-level fitness and competition about 3 months after surgery.